It's vital to ensure that we respond to the challenge in swift manner. As I was conducting my research, I did a secondary analysis because of time. So I looked at most of the researches and studies that have already been done. And to my surprise, there's been a huge gap, especially in studies that have been done around Kenya. It is very limited. And the only data I could find only concerned reports that have been done by various organizations and some small number of researchers, majorly through dissertations and school projects. So as young individuals, I'd like you to take this opportunity to conduct enough research in matters concerning climate change and how it is affecting the health of our citizens. So as I've mentioned, my methodology majorly involved looking at researches that have already been done. And I found out that climate change is indeed affecting our health sector. Majorly, as Eugene said, we had diseases that were not around, as dengue fever. It was mostly affecting people in Bangladesh or people in Brazil. But now, since we are seeing it near our coastal regions, it is a point of concern. And why are we having dengue fever and Ebola affecting people near home? It's because the planet is getting warmer and warmer each day. And when the planet gets warmer, what happens? We create more breeding sites for mosquitoes. And when they become increased in number, we get cases of malaria in areas where malaria was not even witnessed before. So as I was doing my research, several findings came up, and I found out that there is a surge of malaria cases, as Ojiji was mentioned, and it is unfortunate that we are having about 3.5 million cases, and these are new clinical cases in our hospitals. And as we know, our health facilities are majorly affected with factors of resources and capital. So this means that our doctors are facing a crisis as day goes by and as the planet gets warmer and malaria cases increase. And it's unfortunate that around 10,000 people die annually. It's a big number, and they are brothers and sisters, and their deaths are caused by things that we can prevent using not more of resources, but we as just young people and as people who are living on Earth is our home, and we need to take the step of ensuring that we protect our environment. It's easy. Just on Monday, we had siku ya kupanda miti, sindio? Ni wangapi walipanda miti? A few hands. I also did panda miti, and I'm an environmentalist and advocate to that matter. I was engaged, but it should not just be us going out to panda meeting, being given a day. I think it should be enshrined in our policy that as soon as a Kenyan reaches 10 years, they should own, just plant. You know, you can plant and go away, and then after 10 days the tree dies. So we need to own a tree when we reach 10 years. So that would be a good policy. We are about 50 plus million people in Kenya. If we plant 2 trees, how many trees would that be? Around 100 million. So in about, we do this for about 10 years. Then we'll increase our green spaces, and after a period of time, we wouldn't be talking about how climate change is affecting health in that matter. So there are several recommendations that I find as I come to the close of my research. And I found out that one of the things that we need to do as stakeholders or as advocates who are dealing with the environment and health, we need to come together as health people, health professionals, and people who are dealing with the environment, and also as young people who are studying, who have the vigor and they have new innovations and new ideas of how they can come up with solutions of dealing with the nexus between the two. We need to work as one voices. CRT, we have medical professionals doing their thing on the other side. Young people are neglected, as we have heard from the previous speakers, and they are doing their things on the other side. Then we see that we have a divided approach to combating the challenges that we are facing. My recommendations also found that by the move should involve policy initiatives. As I've mentioned before, even if we come here with recommendations and then we do a thing in one day or within a week, we have been given funds and we have made a small impact, it won't make a sustainable impact in the future, because as long as something is enshrined in policy, it means that even the generations that are coming will follow suit. It will be like a cultural thing. So I think we should, as advocates and as professionals in this event, we should focus on advocating for policy instead of just seeking funds to do events which will last a week or a month. And in my closing remarks, I believe as young individuals we are soon to be parents, and some of us are already parents, and Earth is our home. Since it's our home, najua nikienda nyumbani, penye umetoka ulitandika kitanda, ulikunywa chai kwa kikombe, for the ladies, for the men. It's the same. So what I'm trying to say is we take care of our home to suit our needs and expectation, and to bring the comfort that will make us feel well and even just to feel nice. So in a general sense, Earth is our home. And when it's affected, your child will suffer in future because of something that you could have changed in just how many minutes? How many minutes does it take to pick up a litter and put it in the right place, or to dig up a hole and plant a tree? It doesn't even take more than 5 minutes. So I urge everybody who is here to take up the initiative that I've mentioned. Just take a time and plant at least 2 trees, and it will bring a real change. Thank you.